Hello all and welcome to the update for today, 1st of May 2020 for the ANU Medical School. You would have all read that as of yesterday, the ACT was the first jurisdiction that was coronavirus free. This is a great reflection of not just the government's guidelines that were put into place, but of the community that we live in and that we're part of, taking these guidelines seriously, adhering to them and contributing to us being coronavirus free. This has also meant, as we have invoked the Operation Graduate Plan and activated it, that we're now going into stage 4, the contingency mode. And the tasks for this mode are to graduate the Year 4 MCHD students this year, to enrol students for next year, to plan curriculum delivery for next year, to track our students and staff, communicate to students and staff, to manage research opportunities and projects, and to maintain the school operations. And this includes IT, HR, finance, facilities and governance. We have subgroups in place who take this on and who are working on this, and I suspect that the contingency mode will last for quite a while. So now to the quiz as of last week. So the photo that I've shown you was George Herman Ruth Jr., commonly called Babe Ruth. He had other nicknames such as the Bambino or the Sultan of Swat, and he started his career with the Boston Red Sox, became most famous with the New York Yankee, and ended his career with the Boston Braves. He developed a tumor at the back of his throat and was one of the first patients possibly to receive both chemotherapy and radiotherapy simultaneously. The winners are here. The fastest finger was Arvind, who responded within 7 minutes. Most details were given by Patrick, and most interesting fact provided to me by Hayden, who mentioned that Babe Ruth played with Lou Gehrig, who is famous for the Lou Gehrig disease, with the New York Yankees. Thank you for those who provided the answers, and congratulations to the winners. This week's quiz is about this man whose photo is here behind me, and whose photo you can see. In order to work out who he is, you need to look in detail at the photo. He's sitting at a sewing machine. I want to know not just who he is, but what he did, where he did this, and what his contribution is to medicine in the COVID pandemic. What is it that we're doing now that has become in vogue that this man did for the first time? Again, email me and we'll announce the winners next week. When we're talking about research that has come to mostly a stop across ANU campus and here on TCH campus as well, I think it is important to recognise that some researchers continue to contribute and are able to use their research facilities and their connections to help us out in these situations. And one of these people is Nicola Pelfrey. Nicola, as you know, is the director of the Australian Child and Adolescent Trauma Loss and Grief Network. And she's one of those people who translate research into policy and practice work. She will participate in the regular mental health and wellbeing during COVID Facebook discussion that is held by Shane Rattenbury, MLA, every week. And this will be screened on the 6th of May at 5 o'clock on Facebook. Please tune in and see what Nicola has to say to us. She has also been on Facebook with the ABC Kids community and been talking about how to support kids following disaster, particularly the bushfire, and has had other media exposure on crisis trauma and recovery. As we're all isolating or practicing social distancing, exercise has been mentioned a lot to maintain our mental health. Now, Jeff Farrell has shown us that exercise is not just important to improve our mental health, but may also have an effect on liver cancer. His article that has just recently been published demonstrated that exercise reduced the severity of fatty liver disease, and that reduces a molecule, JNK1, that is associated with cancer. Jeff's research, as many others, has come to a halt at the moment. We don't know how long the pause is, but I think it is important to know that we have these research clinicians or academics with us in the medical school who are doing fabulous work, and I do hope that they can go back to their research very soon and continue to publish important papers. A meeting of clinician researchers was held yesterday, and that was chaired by Chris Nolan, who got a big group together. And during the session, the problems for researchers were outlined, and it seemed that there's a difference between the bench research or the lab researchers, the coronavirus has affected research on clinical trials and also those of social scientists, but the grades of effects were different. Professor Groen was attending this meeting as well, and he gave us a bit of an update on the return to research on ANU campus. As you may know, this will be done in a phased approach, and the first phase, hopefully starting next week, is for a select group of researchers, of course, adhering to social distancing and strict infection control practices. But there is a plan to bring researchers and other staff back in the near future, and as soon as we hear what that plan is and what the dates are and how that's going to work, I will let you know. For the students who are doing research and who are at the moment unable to access data that they need from ACT Health or Canberra Health Services, because in order to do that they need an ACT Health computer, I've got some good news. We will open up the student computer room in Building 5, probably next week. This is particularly for HDR students and those Year 2 medical students who may just have to collect a little bit of data, let's say from medical records or so, to complete their project. We'll have a booking system. There are 4 computers available, and they'll be able to be booked by the students for 2 hours at a time, and we'll only allow 4 students in maximum into the room at any given time. And we'll give you the update on how that works, and hopefully can start with that next week. As you know, our students are back in clinical placement. The FIMS students of Year 3 and all the Year 4 students have been back since this week, and as of next week, the ITCH students will return to their clinical placements as well. We have set up a governance group in liaison with Canberra Health Services, where we will discuss how this works, what the processes are, the risk management, and any other issues that we need to know, and obviously liaise closely with the Chief Health Officer on coronavirus in the ACT to take future steps if we need to do them. On further news of placements, the Medical Dean's Education subgroup has developed a list of competencies that they think are essential for graduating students. We have that list and we've mapped that against our portfolios and skills, and we do teach and assess all these competencies, so I'm reassured that we're doing what other medical students are doing, what other medical schools are doing, and also see the competencies the same that are essential. Now that students are back on placement, we need to think of solutions for them to attend small group meeting while they're on placement, because there are not very many meeting rooms available, and we're looking at solutions for that, and hopefully we'll have something for that next week. For the students, I think it is important that you are aware that as of next week, we will send out a risk assessment form. In order for you to go back to your placement, we had to do a risk assessment that ranged from everything from you driving your car to a placement, to getting some physical strain, to mental health and well-being, but also about coronavirus infection. We're mitigating that risk, but it is a requirement of ANU that you are aware of the risks and our mitigation strategies, and that you acknowledge those. We'll send out those forms next week, and we're hoping that you can return them back to us within a week. There will be also a Zoom meeting with the Phase 2 students next Thursday, just to get some feedback on how the placements are going and answer some questions. Wellbeing remains one of the main concerns of the university, and of course for us here at the medical school as well. The HR department at ANU will provide new online training courses to support supervisors and staff. And if you were to have a look at the RSPH website, you find lots of good tips and tricks on how to manage your well-being during these times. The college will also look at new resources to support staff, and particularly look at supports for researchers and their research groups. Students, I think you may know that the student clinics from the Research School of Psychology is available. They don't really take any new students, but there's a 24-hour helpline available for you. For our students, we have set up a quarantine team should any student become coronavirus infected. And we are also, in terms of mental health, negotiating which students are eligible to do the mental health first aid course that can be delivered online, and we've got some funding through the medical deans for that. and we will need to look for some funding for academics who want to do this course for their accreditation, and I'm particularly interested in the year coordinators doing this. Other information is here, so you would have all seen that the COVID Safe app is available, and feel free to download it. We have decided for the OGM meetings to be now held weekly, which means that you will get a weekly email from me, and the students will continue to get their weekly emails as well. If you've got any questions or any issues, please continue to email us on operationgraduate.medicalschool.nu.edu.au. I hope you all have a great weekend, and I'll see you next week.